The elbow is an example of a synovial joint called the hinge joint. The elbow is classified as a hinge joint because the joint is formed from the point where the humerus, which is the bone at the top of the arm, is joined with the radius and the ulna, which are the bones that form the forearm. The junction of these bones is what creates the hinge joint, which allows the movement of flexion and extension, which is this movement here. As mentioned, the elbow joint is made up of three bones, so the humerus, the radius, and the ulna. To continue with its primary structures, the ligaments associated with the elbow include the annular ligament and the radial collateral ligament. Now for the tendons, there are the lateral epigondal tendon, the medial epigondal tendon, the biceps tendon, and the triceps tendon. Now for the muscles, I have used colors to help identify the different locations of the muscles. So firstly, the red represents the bicep muscle, the yellow represents the tricep muscle, next the green represents the brachioradialis, and lastly the magenta is about where the pronator teres is located. Lateral epigondylitis, or better known as tennis elbow, is a common sport and other repetitive movement injury to the elbow. The pain of tennis elbow is caused by inflammation of the tendons that join the forearm muscle to the lateral epigondal, so the outside of the elbow. The tendon that becomes inflamed most often in cases of tennis elbow is called the extensor carpi radialis brevis, or ECRB for short. These forearm tendons, known as extensors, attach muscles to the bone. The extensor tendons are found here, where they attach the lateral epigondal. So there are many treatments for tennis elbow that are non-surgical, such as icing the elbow to reduce the swelling and taking anti-inflammatories. Furthermore, if these self-treatments do not work and the pain persists, there are surgical methods in order to treat it. So for example, most surgical procedures for tennis elbow involve removing diseased muscle and reattaching healthy muscle back to the bone. Now, arthroscopy surgery is a technique to see and treat problems inside a joint. For this non-invasive surgery, a small incision is made and a tool with a camera on the end is inserted into the joint. This surgery technique has many advantages, such as not having to fully open and expose the joint and having a fast recovery. And now you know a bit more about the elbow joint. Thank you.